So you're having outside elbow or lateral elbow pain, often called tennis elbow and so forth. So this can be a significant cause of pain. In fact, I've had one patient who was bobsledding with his kids on a piece of cardboard, and he did so much of it in one day that just almost tore it off the bone. It was really intense injury. So you can have many different reasons for having this. Usually it's gripping a tennis racket or a racket too tight, or I've had patients who are mechanics and were tightening up oil filters and so forth, and that has caused strains in the area. So lots of causes to lateral epicondyle pain, and there's kind of two flavors of lateral epicondyle pain. You can have an epicondylitis, which is where as the tendon attaches, it gets inflamed, or you can have a tendinopathy or a tendinosis, which has gone through that inflammatory process many times, and that creates a kind of degenerative tendon that has difficulty healing. Sometimes we have to really stimulate that process by doing soft tissue work or dry needling to increase the healing, increase the inflammation, and really help jumpstart that healing. To best assess your lateral epicondyle pain, your elbow pain, what we will do is take you through some range of motions. Your neck, your shoulder, your thoracic spine, your elbow, and wrist. Prior to that, we'll probably rule out some neurological conditions in the neck, because it's very common for those to refer down the arm to the shoulder, to the elbow, even to the wrist. And that can cloud treatment quite a bit and make it difficult if you're treating the wrong thing. So we rule that out first, and then start with some range of motion testing throughout your whole upper extremity. So once that's done, then we do muscle testing to best assess where you're weak, if at all, as well as where you're tight. So the range of motion will pick up where you're tight, the muscle testing will show where you're weak, and then we can develop the best possible diagnosis to figure out how to best help you. Once we have a clear diagnosis, then we can start the treatment plan customized to you. So usually it will consist of some form of soft tissue work, because we find that most problems do have a soft tissue component, that it's not just an adjustive problem or not just a rehab problem. So, soft tissue work, we will adjust your neck or your upper back if you need it. Usually people have difficulties getting into good extension in their thoracic spine, their upper back, and that will help put your shoulder in a better position, which will put less stress on your elbow, whether you're doing racket sports or throwing sports. Then there's rehab, where we will focus on your home exercise. So we will strengthen what's tight, loosen what's weak, and improve your technique. Oftentimes we can teach you some of that, or we're talking with your instructor, your coach, to make sure that your technique is as good as possible. So all of that together, working with your coach, soft tissue work, adjusting, rehab, all that together will give you the best possible chance of improving and getting out of pain as soon as possible, and staying out of pain. If you'd like to get out of pain and stay out of pain, give us a call or schedule an appointment online.